Good morning, everyone. Welcome. We're here for the discussion with Chair Deborah Kafoury, Multnomah County Health Officer Dr. Jennifer Vines, and Alice Bush, who is the Division Chief of Operations for Multnomah County's Emergency Management.
Good morning, everyone. I want to thank everyone for joining us on this call, and I'm sorry that we are back to Zoom land. We had a little nice reprieve with our last press conference in person, but we will be there again at some point. I'm Deborah Kafoury. I'm your Multnomah County Chair, and I'm joined today by two people who have been central to our response to emergencies this summer and actually over the last 18 months, and that is our Health Officer, Dr. Jennifer Vines, and Alice Bush from Emergency Management. We are here together this morning to deliver the June 2021 extreme heat event preliminary findings and action steps. We'll say a few words and then we'll open it up for questions. After every large emergency, the county produces an after action report, and typically that report takes months and months to complete, and it includes pages of details for people like Alice, whose whole jobs are about responding to emergencies. But this preliminary after action report is very different because this emergency was very different. First, it was historic. On a single weekend in June, our community experienced 3 days of record heat that none of us, and truth be told, relatively few people on this planet had ever physically experienced before. As Dr. Vines said at the time, and she was right, it was a life-threatening heat. Secondly, it was tragic. 62 people lost their lives to heat-related illness. And we expect that as toxicology reports come in, that number will climb even higher. And finally, it was a wake-up call. The heat wave that climate scientists predicted would happen once every 1,000 years not only happened, but it will happen again. And in fact, we've had 2 very serious heat events since June. And that's why it was so important for the county to quickly look at what worked, what didn't work, and what we needed to change going forward. And we've done that. We've changed how we're using tools like public alerts, unified command, and a state of emergency, where we're locating our cooling centers, and to whom and where we are conducting outreach. Those adjustments come on the backs of candid, clear-eyed look back on our response. But for me, the hardest tasks still lie ahead. We must face what we are doing to one another and to our state and to our community when we fail to honestly address climate change. And we must come together to address what we need to do around transportation, water use, and fossil fuel consumption to really make a difference. The county can't go it alone. No one can go it alone. If we want to truly address climate change and build a resilient and equitable community, it's going to take all of us working together. And I'm committed to do my part. And with that, I will turn it over to Jen Vines.
Thank you, Chair Kafoury, and good morning, everybody. Again, for the record, I'm Dr. Jennifer Vines. I'm the Multnomah County Health Officer. I have just 3 brief comments I'd like to share in response to this report. And the first is just to acknowledge those who died and to acknowledge this idea of crises within crises. So I've lost track of how many times I've been on Zoom with you talking about the impacts of COVID-19, opiate overdose deaths, and now heat deaths in the scores over a very short period of time, and just acknowledging the losses, the many, many losses of the last 18 months that I certainly feel as a health officer, as a physician, and as a human being. And so again, just acknowledging those individuals and their families, knowing that we may yet adjust that number upwards as we get more information about other deaths from that time period. The second piece I want to say is I want to acknowledge the response itself. We quantify what happens, we quantify things, but we can't quantify what didn't happen. And I would like to think that our efforts that weekend helped many people, may have saved lives. But I just want to say that there is no comparison for that particular response. And so there is no way to know the exact impact of our actions, but I was one of hundreds of Multnomah County employees responding through that weekend with a real sense of urgency. And so I do want to acknowledge those efforts. And then finally, I want to point out that I have worked at Multnomah County for over a decade. It is a learning organization. I think there are clear lessons here, and there's always a sense of striving in service to the public, and always a sense that we can do better. And so I want to really appreciate the work that went into this report, and certainly commit to the recommendations and changes here. So I will pass off to Ms. Alice Bush.
Hi there. I'm Alice Bush. I'm the Division Chief of Operations for Multnomah County Emergency Management. And I've been engaged in emergency response work since 1991, and I have never experienced so many significant overlapping emergencies. Our team has been working incredibly hard, and they continue to show up and serve our community to the best of their ability, emergency after emergency. And like Dr. Vines said, I'm proud to be part of a team that really leans into learning, and I'm proud to be part of an organization that encourages the kind of honest dialogue about how we can improve that we have been engaging in. Chair Kafoury mentioned the candid look that we engaged in during our after action process. And this process meant that we immediately began to gather information from all of our responders right after the crisis, and every phase and every level of the response was examined. We also immediately began to incorporate the lessons from June into our response efforts. From wireless emergency alerts you heard on your phone last week, to opening the first cooling center in a new Portland public school, to behavioral health support at our cooling centers, we are and will continue to work together to leverage the strengths of our individual organizations, our communities, and our partners. And I think that that leads us into any questions that any of you may have.
Thanks, Alice. If reporters can, if you want to put your name in the chat, we'll just go ahead and call it. Seems to create a queue that people can follow along if you just want to put your names in. And then you can unmute yourselves and ask your question. Elise Haas from COIN, would you like to go ahead?
Yeah, so our main questions revolve around in-person outreach, we were told in your reporting. You talked about how that was going to be prioritized. I had a coworker, Lindsay Nadrich, who had tried for days and days in a row to go out with folks. And every time we tried to go out with in-person outreach, it wasn't happening. Phone calls are being prioritized. Eventually, we got to go out with the firefighters. But do you have some specific numbers for us for how many people were out on the streets knocking on doors? Because it was difficult for us to even do that. And then my second part of that question is also working with the affordable housing units and the apartment managers to do that kind of work, because we also know that a lot of people who are vulnerable are in those settings. Did that happen with those apartment complexes and those apartment managers? And what are we doing to make sure that that happens?
Alice, do you have any numbers? I don't have any off the top of my head for how many people were doing outreach or how many apartment buildings that we contacted. Happy to get back to you with that information, but I don't know. Alice, do you have any of that at your fingertips?
No, not specific numbers, but we can certainly get that. I do know that we reached out to apartment managers and asked them to open spaces, cooling spaces in their facilities. And we know of a few of our affordable housing partners that actually did door-to-door. I imagine that it's not necessarily something that folks may feel comfortable having others join them on the door-to-door with their clients that they're serving. So that might have been a limiting factor as well.
Elise, this is Julie Sullivan-Springhetti. We can get back to you on that. I would say that it was a combination of, there were, more than 30 outreach teams out with the joint office, and they were out every single day, and connecting with them were sort of difficult. That said, we can get back to you with more of the specific numbers, and if anybody else wants them, just send us a chat. With that, we're going to ask.
Send you an email.
You can go ahead and send an email, Elise. We'll go ahead and do that. If we can go to Nicole Hayden from the Oregonian.
Good morning. I had a question about, in the report, it mentioned work that would expand programs to bring cooling systems to people who are low income and vulnerable, whether that's expanding already existing programs, working on policy, or educating folks about what programs are out there. I was wondering if you could tell me a bit more about exactly what programs you'll be working on or expanding.
I think we're while we had hoped to have an extensive list as we've gone through 2 heat events since this heat event in June, we're looking at our own weatherization program at Multnomah County. We're also talking with the city of Portland. They have the PSEF program, which voters implemented last year. There are dollars there for weatherizing homes for low-income individuals. And we're also looking at legislation. We're working closely with our members of the Oregon delegation, our state representatives, to look at removing barriers to allow people to have air conditioning units in their apartment buildings. And then I know that the city of Portland, who does construction of affordable housing, is looking at ways to include cooling systems in the new construction that they will be building with housing bond dollars.
Thank you.
Thanks, Nicole. Jim Redden, Portland Tribune. Jim, you can go ahead and unmute and ask your question.
The New York Times has speculated that the number of people who died because of heat-related causes may be quite a bit higher than the official number. And I know that Jennifer Vines has said that she thinks that is a possibility. Is there any way to accurately determine how many people may have died of something that was heat-related, if not only the heat?
Sure, so I can take that question. I'm familiar with the New York Times article you're referring to that used aggregate death data to show excess deaths during the period of intense heat. That is a real phenomenon that's well documented, that deaths overall go up during heat waves. The reason for that can be increase in violence, increase in drownings as people flock to bodies of water to stay cool. And then similarly, people who may never be under the medical examiner's jurisdiction, but die of natural causes under the care of a physician, where it may not be clear that the extreme heat is what tipped them into a real health crisis. So as far as a notion that we've undercounted heat, like specifically heat-related deaths, we do the best we can within this sort of death investigation framework that we have. So the ones that we are reporting as due to hyperthermia are under the jurisdiction of the medical examiner and get certified, but many other types of deaths will not get that level of scrutiny depending on how and where they happen.
Thank you, Dr. Vines. Rosemary?
I guess I'd like to ask, as you look at what happened in June and you compare it to what just happened a few weeks ago, do you really feel that you made progress and you were able to make some sufficient changes? I noticed more cooling centers, including the one at the school, which Alice, you mentioned. As an emergency management person, do you think the county's headed in the right direction with what it's learned so far?
Definitely. We were able, I had the fortunate position of working with all of the people who were responders during the June event. We had 15 hours of listening to all of the responders, their ideas about areas for improvement. We had surveys and one-on-one interviews, functional group interviews. And because of that, and then being one of the unified commanders for this most recent heat wave, we were able to incorporate almost all of those kind of shorter and midterm improvement areas, including creating a unified command structure with the city of Portland, our partners, and pre-event trainings for people who had never worked in cooling shelters to better prepare them for that work. The integration of behavioral health, the list goes on and on. A lot of the items that you will find in the initial findings report have already begun to be incorporated into our response operations and improve our response operations.
Thank you.
And I'll just add, Rosemary, that I think all of the changes that we made were due to the greater coordination between the jurisdictions and our community partners. The heat wave in June was really a wake-up call, and since then, in the two subsequent heat events, we have had much better participation and outreach from the city of Portland, smaller cities in our county, school district, TriMet. All of our partners really came together, and that helped us so that it wasn't just Multnomah County alone.
Thanks, Chair. Isabella Garcia from the Portland Mercury.
Yeah, so the cooling centers and shelters, they rely pretty heavily on volunteers. And with, but even this last heat wave, there was, definitely a call for needing more volunteers repeatedly. That happened the last couple of heat events. As these heat events become more common, we've had 3 in the past month and a half. Is relying on volunteers a sustainable model, or is the county looking to have develop a regular pool of trained volunteers to help with staffing instead of relying pretty heavily on county employees and city employees and some other services coming in and volunteering?
Alice, do you want to talk about the training program? Because we do train the volunteers who are working at these shelters. Go ahead, Alice.
Yeah. So I think and this goes to all of us working together. None of this work is going to be accomplished by the county alone, by county staff, or even by city staff, and nor should it be. There's a lot of community-based organizations that do this work with our populations throughout the year, have relationships and rapport. We have the Disaster Resource Center training is an online training to help encourage our communities to step forward during disasters. The Neighborhood Emergency Team is a large pool of volunteers who regularly step forward to assist in these events, and that is our model. All disasters are local, and the people that live in the communities that we serve are some of the best people to work with their neighbors and friends who are impacted by the different disasters. We are also looking at integrating this work into county staff, as is highlighted in the findings report. We're looking at ways to make this more of a regular part of people's work. And we're working with the city of Portland and our other cities to see how we can support them in doing the same. So I think it's actually cause for celebration to see the number of volunteers that are engaged in these response efforts, and the number of county staff and city staff who are stepping forward to do this work as well. So I agree that there's always more work that needs to be done than we ever seem to have the capacity to provide. And we are constantly building our bench strength. And that means looking outside of just the city and county and public agencies to provide the work.
Thanks, Alice. It looks like Elise has a second question. Elise Haas.
So we were going through your report, and on page 15, you talked about how the cooling centers don't work for everyone who is at risk for a myriad of reasons. So just curious at this point, if your findings reveal that cooling centers don't necessarily work for everyone, especially some of the most vulnerable folks, whether that's for transportation or other reasons, we're just curious, why was there so much effort on opening more cooling centers for the August heat wave?
Well, I think both can be true, and we're really looking at every way to get at individuals. One of the reasons that we opened up additional cooling centers was because we wanted to have a geographic distribution We know that we looked at where the heat islands are in our community and wanted to make sure that we had locations near there. So people weren't having to get transportation to get a ride way across town, that they had something close to where they live. But that doesn't mean, as we said in the report, that everyone is able to leave their homes. And that's why doing the outreach via phone, doing the door-to-door outreach is also so crucial, to reach people and let them know that there are options available to them, and try to reach them and make sure that they're safe. So I think it's really a both and.
I'd like to add to that in that one of the trainings that we will be increasing is our wellness check trainings. So the past two events, standing on the shoulders of June, we're much more coordinated with our community-based organizations and our city partners in the outreach to those who were not utilizing the cooling centers. So I think all of us that have an older loved one know how stalwart they can be when there's an emergency, and as much as we try and cajole them into a safer location, sometimes they resist. So that is outlined in this report, that we will be doing some in-depth research and study into what are some of the barriers that people experienced when they were trying to talk their friends and loved ones into maybe coming to their house to cool off. You know, I had an older father who would not take care of himself. But if I was able to talk to him in a way that it was about me, "Hey, Dad, I just really need you to come keep me company and play some bingo," he would be much more willing to come somewhere safe than if I said, "Dad, this is for your safety." So we're going to be doing some listening with our communities to see if we can increase the effectiveness of our wellness checks and the door-to-door to see if we can meet people where they are and keep them safe, whether that's going to a neighbor's home or a loved one's home in lieu of a cooling center, or the other efforts that are also detailed and were discussed earlier about cooling spaces in facilities, and then other mechanisms that we can provide to people that are going to be staying in their homes.
Thanks, Chair and Alice. We have time for like one or two more questions if anyone has any. If not,
Julie, Isabella Garcia had a second question.
Okay, Isabella, awesome. Go ahead.
Thanks. So there was a reference of talking to TriMet as a partner, talking about policy level discussions, making sure people are able to access buses to get to cooling centers, et cetera. Was there conversation between county and TriMet, policy level conversation in between these previous heat events since June? I know that there was some confusion, especially over their policies shifting as things progress. There was a 100-degree threshold at one point that before rides became free. What was that like in between, and why haven't we seen changes immediately after that June heat wave?
Yes, we've been in constant conversation with TriMet since the June heat wave. And I would say that we did see a change this last heat wave. Oh, good. Was it last weekend? The dates elude me at this point. They actually they were very vocal, proactive in letting the public know that if people needed to get to a cooling space, originally they had language that said cooling centers, and we worked with them to modify that so it was any place that was a cooling space, that they would be folks would not be charged for that fare. The Multnomah County Board of Commissioners actually sent a letter to their board of directors asking for a consistent, concise, and proactive message about free fares when there is a declaration of emergency declared by the county and the city or the state. So we have been in conversations. In fact, I just was talking with the general manager, Sam Dessou, yesterday about this, and know that we are working together much more productively.
Thanks, and thanks, Chair Kafoury, for conducting this while raising children. So we'll go ahead if nobody else has any questions. I've taken some notes, but please follow up with myself or Ryan Yambra if you have any further questions. And I just want to thank our speakers, Chair Kafoury, Dr. Vines, and Alice for joining us today. Thank you. And the report is online. Again, it's in the chat. Take care, stay safe, wear your mask.